schools and school district who are working really hard to make education opportunities available to kids who have been dismissed from school, but still need to have some instruction at home. So all of that together has resulted in some social distancing that I believe has for now slowed down the spread of COVID-19. When we, in the first few days after our first cases of COVID-19, we were experiencing, we had a few numbers, but it looked like we were having a somewhat rapid rise in COVID-19 cases. But shortly after that, with the implementation of social distancing in Monterey County, we were able to slow down the spread of COVID-19 in Monterey County. So we continue to have more cases, but the rate definitely slowed down. So I just want to thank everyone for what you've done so far to try to slow down the spread of COVID-19. What we have before us is a pandemic that continues to spread throughout the world. And we don't have to go very far to see that what the impact is of COVID-19. Just in Santa Clara County, that county has had in the last week a more rapid increase in the number of cases in COVID-19. And what has been shared from those county health officers with me and others in California in public health is that even with the social distancing that's been achieved through the stay-at-home shelter-in-place orders at the county level and the state level, the predictions in those counties is that they are probably still, the demand for hospital-level care is probably going to exceed the capacity of the healthcare systems in Santa Clara and their neighboring counties. So in order to reduce the amount of demand that exceeds hospital capacity when they reach the peak of their surge, and to also shorten the duration of the peak during their surge, they did some analysis and determined that further stay-at-home orders and restrictions in their community could likely further minimize the impact on the healthcare system. Again, it's really important that we do what we can to protect the healthcare system, because when we get to our peak of surge, we too may exceed our hospital's bed capacity, and in that situation, it will be very difficult to provide the level of care that everyone in Monterey County deserves. So with that in mind, and also knowing that we continue to have more cases, and now we've had 2 deaths among Monterey County residents. At this time, I think it's important for Monterey County to as well implement more restrictive measures to enhance social distancing. So today I signed a health officer order that extends the current order, and this order will go into effect tonight and will stay in effect through May 3rd of 2020. I chose the health officers in the Bay Area chose May 3rd for as the duration of their health officer orders, in part because their modeling shows that they may be experiencing their peak shortly before May 3rd, and it gives the health officers some time to determine what changes to the health officer orders they may need to take when they get to that point. For me, I decided to maintain the same end date. It'll align us with efforts with the Bay Area counties and our neighboring counties to the east and to the south of us. So it will go through May 3rd, and it has again, the intent is to increase social distancing, protect our vulnerable populations from complications and death due to COVID-19, and preserve our healthcare system. So there are some changes that, Maya Carroll, who's our county public information officer, has posted the, I believe she's posted the order. So Maya, do you want to share with folks where they can find the order?
I have not posted it yet. There is staff doing that, and we will do a follow-up to our media briefing as to where the information can be found online.
Okay, thank you.
Sure.
All right, so what I intend to do this afternoon is to just point out some of the changes in the the differences between this order and my previous order, so that when you go, I'm hoping that'll make it easier to and quicker for you to find these changes in the new order when you review it. So one of the changes or differences is that there's a greater emphasis on employers to direct their employees to work from home. And also that the order does identify essential services, but it also requires essential services to develop and to post and to implement social distancing protocols at their facilities and also outdoor work areas. So this, if some facilities, some businesses have already done this. You might notice when you walk into some facilities at the lobby or the door, there's some postings encouraging, telling people that they're sick, they shouldn't enter, for one. But this protocol goes further than that. And it's something that will be attached to the order. And all businesses that are allowed to stay open or encouraged to stay open should do this in order to protect their employees and also to protect people who are visiting those businesses to receive essential services. Another difference is that this new order provides more restrictive restrictions on social distancing. This is because there's, as I mentioned, there's a rapidly increasing number of cases in the counties just north of us, and our experience is following their experience. We also know that there are asymptomatic individuals. Those are people in Monterey County that they feel fine, they have no symptoms. However, some of them are still infected with COVID-19, and they're transmitting COVID-19 to others. So these are asymptomatic people who are infectious. Increasing the social distancing will decrease the number of times that a person might encounter another person who actually is infectious but looks fine. There's also evidence that, as I mentioned, social distancing has slowed down the spread of the virus here in Monterey County and in the other counties, as I mentioned. I want to also point out that by further providing more social distancing, the people who are vulnerable are going to be more protected, and just a little more detail there. So these are people that are over 65, anyone with lung disease such as asthma, diabetes, heart disease, kidney disease, and liver disease, and individuals who are immune compromised. These are often people who have HIV who are poorly treated, but also includes people who, for example, who have cancer, who are battling cancer and are undergoing immunosuppressive therapy. These are the people that we're trying to protect. We also have this order does clarify travel restrictions, which were in the I believe in the previous order, but as a reminder, the state orders, I don't believe clarify travel restrictions. So we have travel restrictions in this new order as well. The order also clarifies limitations on outdoor activities. We received quite a few phone calls and emails from folks who are really trying to interpret the previous health officer order and to do the right thing. So the new order, when you read it, you'll see that that there are strategies to reduce crowding at parks. There are strategies to not allow use of what I call high-touch areas, which include, as an example, playground equipment, where the virus could survive on some playground equipment, and children and their parents could touch the equipment and touch their mouth and nose and infect themselves. It also prohibits use of shared facilities for recreational purposes, such as golfing, tennis, and team sports and fields. But it still allows for use of open spaces for non-recreational purposes. That would be walking and hiking and jogging. It provides clarification on funerals. There have been, unfortunately, there have been funerals and funeral events still occurring in California, where hundreds of people are still gathering, and it is has the potential to and can lead to further clusters and outbreaks within our counties. So there's restrictions on funerals. I'd like to also just share with you that I and my other fellow health officers in California are really urging families to delay memorial services till later, limit the funerals to 10 individuals, and then have gatherings when we're beyond a point where there's still significant concern for transmission of COVID-19. So those celebrations of life can still happen, but they shouldn't happen now. There are some limitations on residential moves, recognizing that some people do need to move for certain purposes. That's in there. It also, this time we actually put a definition of a business in the order as well. And there are limitations to construction that are provided in more detail. Construction will be limited to essential infrastructure, to construction for maintaining healthcare facilities, for affordable housing, for public works projects, for shelters for vulnerable populations, including the homeless, and projects that protect other vulnerable populations, such as the elderly, and projects that support essential businesses. This order also clarifies that certain types of car sales are allowed, such as online car sales. And it also addresses a concern that arose regarding sales and rentals of residences. This new order will clarify that residential transactions should occur virtually. If they can't occur virtually, then they should occur by appointment only, and that no more than 2 visitors who are from the same household can visit a property at one time, and only one person showing the property can be there. And in addition, that there are no inhabitants present on the property when the house is being shown. The order also addresses arborists, landscapers, and gardeners, to point out that they are still allowed to provide their services to maintain safety, sanitation, and the business of residents. Examples include tree trimming for safety reasons or fire safety reasons. And they do not include services for cosmetic reasons only. In addition, all essential businesses, as I mentioned before, will prepare and post social distancing protocols. I'll give you a little more details to what the protocols will include. They will include limiting the number of people who are in the facility, as well as maintaining 6 feet distance between people who are allowed in the facility. The businesses, essential businesses, need to provide hand sanitizer or access to soap and water. They should switch over, if they haven't already switched over, to contactless payments where you don't have to touch equipment to pay. They should have they should establish regular cleaning schedules, and as I mentioned earlier, posting signs saying that people who are sick should not enter the essential business. The order also expands on some social distancing requirements. So I just wanted to bring that to your attention so that when you look at the new order, you'll be able to focus, when you read it, focus in on those particular areas as being different, enhanced, or new, excuse me, in this health officer order compared to the prior order. So with that, I'm willing to take some questions, Maya.
Actually, before we go into questions, I thought we go through our speakers first so people can get the full picture of the changes in the order. One component of the order has been enforcement, and there have been some questions about enforcement. We have Under Sheriff John Mineau on the line who might be able to speak to that.
Thank you, Maya. Yes, we got a copy of the order today. We're still going through it, and appreciate the chance to hear from Dr. Moreno about some of the changes. We're going to take a very similar approach to what we've done already. The best way for us to deal with these things, we want people to comply with the law, and we've really done that through communication and education. And if we see people out or gathered or grouped or doing something that really is in violation of the order, it's been get with those folks, inform them, and get them to disperse. And we really haven't had any trouble with people being openly defiant or outwardly going against the health official's order. If obviously the code sections are cited, it is a misdemeanor. It's something that could result in an arrest. Obviously, that's certainly not our goal. We want people to comply. We will encourage them to comply with the law. And ultimately, if folks are blatantly defiant to that or won't heed those warnings, then we'll take enforcement action if we need to. Thank you.
Thank you, Under Sheriff. Also on the line is Berkeley Brannon from the District Attorney's Office, who can also talk about enforcement issues. Unmute.
Thank you. Sorry about that.
Gotcha.
Thank you, Maya. I definitely agree with everything that the Under Sheriff said. What we're going to be focused on at the DA's office from an investigative end is we're going to be looking at businesses that aren't complying with the order. And if you're not an essential business and you're in business and you're doing business, that's going to be a problem. Our goal is to try and keep the public safe, number one, and number two, it's to enforce the law. And if we have businesses that are complying with this order, obviously that is something that is affecting their bottom line. They're doing that for the public good. They are doing their part to make sure that COVID-19 isn't spread throughout this community, and we don't have a lot of people dead. So if businesses aren't doing that, they are conducting business in violation of the order, that is an unfair business practice. And the people who are following the rules should not be at a competitive disadvantage vis-a-vis people who are breaking them. And so we will be investigating those matters. If people see businesses that don't appear to be an essential business as defined in the order, they can go on the DA website, the Monterey County District Attorney, my boss, Janine Paccioni, that website, and they will find a link so that they can issue a complaint there. And it's consumercomplaints@co.monterey.ca.us, and we'll investigate those. Obviously, we want businesses to comply voluntarily, and if it's a marginal situation, we want to do warnings. We want to try and reach people through education, but you know, the civil penalty for violating, for being an unfair business practice is $2,500 per day per violation. And it can also include losing your profit in restitution. So the penalties can be severe, and we want people to comply, and we want to do our part to see that folks are complying with what Dr. Moreno has outlined here. Thank you.
Thank you, Berkeley. And then we'll go to Charles McKee, our County Administrative Officer. The shelter in place is a big issue that affects the entire county, and he can certainly give us a sense of the importance and the impact it's having on the county.
Thank you, Mayor. I appreciate the opportunity to give a perspective from the County Administrative Office. We are coordinating a number of different avenues to implement the health officer's order, as well as just to do what is right in trying to stem the spread of COVID-19. And I think what the message that we want to get across is that we recognize the big changes that this is putting on our community, Monterey County, and the world. We understand the imposition that it's putting on people and the changes in their lives that they have to endure. You know, the health officer for Monterey County has a tremendous amount of responsibility. There is an awful lot riding on his shoulders. He has to make decisions for the health and safety of the whole community, and also to protect the potential spread outside of our community. He doesn't take any of these decisions lightly. They are matters of life and death, literally. There have been many mistakes across the globe and how many countries, communities have dealt with COVID-19 and coronavirus. And you can see also some successes about how the novel coronavirus and COVID-19 was addressed or is being addressed across the world. You know, when the mistakes are happening, most people are saying, yeah, you should have done it this way, you should have done it that way. There are a lot of people who are telling the umpire how to call balls and strikes. And of course, I do it myself on a Saturday afternoon watching a ball game. You know, but this is a lot different. And we are talking about the health of the globe, and we're talking about the health of our community. There's been comparisons to New York, and people saying California is not New York, and I agree with that. California is not New York. Monterey County is not New York. We certainly don't want to become New York in the COVID-19 situation. So we want to make sure that the methods that we're taking are appropriate. And what you've found across the globe is that one of the things that has not been a mistake. One of the methods that has not been a mistake is taking strong measures to prevent the spread. Taking the orders of sheltering in place, taking the orders to only have essential businesses operate, have not resulted in being a mistake. And as the health experts across the globe say, we hope when this is over, people complain that we overreacted, because what that will mean is that people lived and it didn't spread. You know, if we make there are a lot of businesses out there that say we can do a good job of social distancing, and many of them can do a good job of social distancing. There's no doubt about it. However, good is not good enough right now. If we make mistakes, if we're not strong enough, then the spread of COVID-19 is going to happen. And it's not just that you might get it or your colleague might get it. The problem is the overwhelming of our healthcare system here in Monterey County. What has happened in New York is showing that when you overwhelm the healthcare system, and what you saw in Italy, where healthcare workers, doctors had to decide who was going to live and who was going to die. We don't want that here in Monterey County. And if you may have a business that, or a worker that is not sick with COVID-19, but they may break their leg, they may hurt themselves in a fall, or you may have a loved one, a parent that has a heart attack, and they may not be able to be seen in the hospital because there isn't any room, or the paramedics can't staff the ambulances because they're sick. We don't want that situation. So I appreciate all the steps that that we're taking here that are strong steps to protect the county of Monterey. And now is not the time to be Monday mornings quarterbacking, second guessing. Now is the time to lead. And I appreciate those leaders in Monterey County who are taking the strong steps. In the future, if there are reasons to adjust the order, to make exceptions, the health officer will look at that and make those changes accordingly. But I want to implore everybody to recognize the seriousness of this situation and not become New York and not have it so that we are paralyzed by COVID-19. Thank you, Maya.
Thank you, Charles. And then we're going to open it up for questions. But before I do that, the shelter-in-place order is now posted online. It's on a page in the health department. So that's mtyhd.org/shelter-in-place, all one word. We'll also send out a link, perhaps during or for sure after our press conference is over. So I'm able now to take questions. You can either use the hand raise function, you can use the chat function, or you can just announce your question on the phone. Anyone want to start?
I'll go. This is Pam Marino from the Monterey County Weekly. For essential services businesses where there's the possibility that employees could work from home, is that what you're recommending, that as many people who can work home do that?
Yes, so the order does identify the essential services and encourages people who are providing essential services to provide those services. However, while they're providing those essential services, as much as possible, their employees should work from home. So some essential services can work from home, some of them can't. So we have healthcare workers out there who most of them can't work from home. They have to be in the emergency department. They have to be at the bedside. But we have other essential services out there where staff and support staff can work from home. So definitely, as much as possible, those employers should find ways to have employees work from home.
Thank you, Dr. Moreno. I have a question on chat. Superior Court sent out a message to court staff that while they will remain closed, staffers are requested to return to work on Monday. How does that jive with the new order, and what is your opinion on that?
So the court is would be considered an essential function, and it's still up to every employer to determine how the employees can complete their work. So if an employer has, so I can't comment on whether that's the appropriate decision or not, but I can say that we in the health department are happy to receive calls from businesses or government agencies on how to maximize social distancing among the workers that are providing essential services. And our number is 755-4521, and we have folks that are taking calls from the public that would be happy to help.
Thank you, Dr. Moreno. Another question. The CDC is now recommending that people wear facial coverings while out in public. Is Monterey County making the same recommendation?
So thank you for the question. So actually, I know that the California Department of Public Health has issued guidance this week on face coverings. And I just want to point out, some of you might have heard it earlier news media briefing, that that guidance applies to all Californians, including folks living here in Monterey County. I want to make sure there's a distinction, though, between face coverings and masks. And so what the state is referring to are coverings. So these can be homemade using pieces of cloth and strings, or bought online, already made for you. But it could also include something that you could wrap around your face, like a scarf, covering your nose and your mouth, which is different than the masks, which are the surgical mask and the N95s, which are direly in need by our healthcare system to protect our healthcare workers. So the other thing I want to just remind people and this is important, that is, all the social distancing requirements are still in effect in Monterey County. So people covering their face should not have a false sense of security that now they're protected and can go out and disobey the health officer order. All it does is it covers your mouth in the event that you are actually infectious and you don't know it, because we know that some people are infectious and they have no symptoms whatsoever. They can be infectious for up to 2 days before they develop a cough. And so covering your face, particularly your nose and your mouth, might actually decrease the spread of the virus in our community by stopping the virus in the face covering and not letting it get into the air.
Thank you, Dr. Marino. And I'm going to let CAO Charles McKee step in and add something to the previous question.
Well, I just, on whether the courts have ordered their employees back to work or whether they're opening, my understanding is that they are not doing it at this point, but I'm going to try to confirm that and get back to the group.
Thank you, Charles. I have another question in on chat. Does the new order prohibit driving to open space parks for exercise?
So no, the new order does not prevent people from driving to get physical activity. However, the order does, and I believe the way we wrote it, does acknowledge that the health officer or agencies responsible for the parks can take action as necessary if they determine that social distancing is not achievable in parks. I also encourage people to try to get physical activity within your neighborhoods, because if we can keep people in their communities and in their neighborhoods, that also reduces the amount of spread from one community to another community.
Thank you, Dr. Moreno. Are there any other questions? Okay.
May I, if I could
Yes.
just, yeah, so if I get that information about the courts, I will send it through and hopefully we can get that out into the media.
Oh, and I do have a question that just came in. Does the new order change enforcement powers at all? And that may be a question for the undersheriff or Mr. Brannan.
Yeah, no, I don't think it doesn't change powers. It's a violation of state law. It's a misdemeanor. The unfair business practice statute is a state statute that exists independent of the other two statutes I just mentioned. So it doesn't change our powers. It changes what the focus is. So if there are more essential, if there are fewer essential businesses, then obviously that fewer number, the decrease is going to be affected by the order.
Thank you. And Undersheriff, do you have anything to add?
No, agree. The authority code section and the authorities granted remain the same.
Thank you. And then we have another question. The essential businesses have not changed, correct? For instance, liquor stores and dispensaries can still remain open.
Okay, so the order, that part hasn't changed. It reads, the businesses included in this subparagraph include establishments that sell multiple categories of products, provided that they sell a significant amount of essential products identified in this subparagraph, such as liquor stores that also sell a significant amount of food. So those are the type of stores that I think are essential.
Thank you, Dr. Marino. Are there any additional questions?
Matt?
Yes.
This is Joe Sadowski at the Salinas Californian. I have one question that I had was, what would you say to someone who says, you know, we don't have that many cases? You've been talking about how we've been successful in reducing the spread. I mean, cases are doubling every 5 or 6 days. Is this really necessary, or or does it seem like excessive? What would you say to people who are wondering that?
So thank you for the question. So we can look at models to see what's going to happen in Monterey County. But I think we just have to look up north a couple hours from here to see what's happening in Santa Clara County. And we've taken a good look at their epi curve or epidemiological curve, and it's on a steep increase now. And they're really just a few weeks ahead of us. And so they've taken this action earlier this week. And I'm hoping that taking this action now is going to continue to slow the rate of increase of cases in Monterey County. So my response to someone is that this is the time to act. If we don't act and do everything we can to slow the spread of this virus, then when we do get to that peak, and we will get to a peak of cases in Monterey County, if we don't do everything we can, we're going to regret it, because our hospitals are going to be overrun, and you or I or anyone else that needs hospital level care are going to suffer, because it's going to be difficult to get that care. So that's what we have to do, everything we can now.
Thank you, Dr. Moreno. And here's another question for you. What factors might change the end date of May 4th for this current order? And when can the public expect an update on the anticipated end date?
Certainly. So we'll be looking at in the next, maybe as soon as the next a week or two, I anticipate we're going to have additional cases, and we'll probably start seeing more cases per day. I think the most we've had in one day is 7, but at some point, unfortunately, we're going to start seeing more than that every day in Monterey County. So when we get to that point, we'll be able to we'll have a better idea of when we're going to reach the surge and how long the surge might last. But at the same time, we're going to see what's happening in our Bay Area counties, and we can learn from them and determine when, based on how they're experiencing COVID-19 and how they're modifying their health officer orders. Hopefully we'll still have an advantage that we're only a few weeks behind them, and we can learn from their experiences and make adjustments that, based on what they've learned, that can continue to reduce the spread and save lives.
Christopher Salas with KSBW. You talk about that worst case scenario if the surge exceeds, hospital capacity. What is the county doing, or in conjunction with the hospitals, to try and increase that capacity if that scenario comes up?
Certainly. So the hospitals are actually, I'll answer briefly, because I think Charles McKee I know Charles McKee is also familiar with what we're doing, but just quickly, the hospitals are implementing plans to to provide surge capacity being the number of additional beds that they can use to admit patients above and beyond their day-to-day operations. So each hospital is working on that. And in addition, we're working with the hospitals. We'll be working with Gary Millay, who's our emergency services manager overseeing the Emergency Operations Center here in Monterey County, to work together to identify the types of patients that the hospitals may not be able to provide care for, and how we're going to work together to find solutions that may not be at the hospital itself. So we're working on that. We're also looking at solutions for people who don't need to be hospitalized, but are infectious and should not, if they're homeless, they shouldn't be going into the homeless encampment, as an example. And we're looking at other populations to see if maybe we could do something similar for farm workers who are living 4 to 8 in a room. And if they become infectious, we may be able to find a solution in working with the ag industry and the ag commissioner to find a solution to get them out of the congregate living facility in the hotel, for example. until they're no longer infectious. So those are some of the things that we're working on.
Thank you, Dr. Moreno. This is Charles McKee. In addition to what Dr. Moreno was talking about with the hospitals and surge capacity increases at the hospital, as well as some alternative sites for those who do not need to be hospitalized, we're looking at different opportunities throughout the county to stand up alternative care sites for those who may not be needing an intensive care unit, but might need some sort of medical care. And it's obviously going to run the gamut. And we're looking at different sites throughout the county that might be appropriate for that. And we're going to also work with the state on their database of available volunteer healthcare professionals, because as you can imagine, just having a bed is not good enough. An ICU unit or bed doesn't just become an ICU bed just by being in a certain room. You have to have the right staff in that situation helping out that patient. For example, ventilators just can't be run by anybody. They're usually run by a respiratory therapist, and there are others that may have that capability, but you need to have qualified personnel to staff these hospital beds, hospital units, and even alternative care sites. Now, with the governor's executive orders, we can increase the minimum staffing levels that are required for each one of these situations, but we still need qualified staff to be able to help the patients. So we're looking at standing up alternative care sites as well as getting staffing for them.
Thank you, Charles. I have another question. Is there an estimate of how many Monterey County residents have COVID-19 but have mild or no symptoms and don't know it? Can you please comment on why people who may not appear to be sick should adhere to this order?
Sure, certainly. So I don't have an estimate for Monterey County, but there are other counties and cities in the United States who have been conducting performing tests on individuals who otherwise wouldn't get a test. These would be people with mild symptoms that that don't need hospitalization, that they're not healthcare workers, for example, or people who just want to be tested. So in some of those tests, I think about 2 weeks ago, about 10% of people who are basically just being screened because they want to be tested were positive. And so that's evidence, and that's here in the Bay Area. So that's evidence that there are people out there who don't have any symptoms who are considered infectious. So unfortunately, we don't have the ability right now to conduct similar type of testing in Monterey County. And that's because we still really just have the excuse me, the CDC test equipment that testing supplies available to us, but it's in limited amounts, and so we're still prioritizing people to get tested. So it is that. So there's evidence that here in California, there are people who are asymptomatic who are infectious.
Thank you, Dr. McKee. Are there any additional questions?
No, but I appreciate being called Dr. McKee. That was Dr. Moreno.
You just got a raise, right?
May
Are there
I have a
any
question.
additional questions from any other doctor?
May, I'm not a doctor. I'm just with the Californian, but I wouldn't mind the pay raise. But I do have a question for Dr. Moreno. So can you give us an idea of what you're looking at in terms of when you might start relaxing some of these restrictions? Like an idea of something that people should be looking for to just be a light at the end of the tunnel type thing.
Oh yeah, certainly. So it's an important question because it's got to be on a lot of people's minds. When is the restrictions? Well, when is the virus going to ease up, and when can the restrictions ease up as well? So I won't be easing the restrictions until we've gotten through the peak of the surge on our healthcare system. So to give you an idea when that might be, I can give you a ballpark and basically give you a ballpark figure. So the Bay Area counties are looking at their surge probably being around the last week of April, first week of May. And because we're a few weeks behind them, and they're not, they put their end date for now around that time, but their order states that can be amended as needed. So again, since we appear to be a few weeks behind Santa Clara and County and the other counties, I can anticipate that if that happens and our peak happens after the first week of May, our restrictions will remain in place. There's a good chance will remain in place after May 3rd, but I added an end date just so that we are, in a sense, to some degree, epidemiologically aligned with the Bay Area counties, and we'll really take a good look at what's going on in the Bay Area as to what type of restrictions in the health officer orders appear to have been most effective if they can determine that. And we'll learn from their experiences and make adjustments as necessary to reduce the number of cases here in Monterey County.
Following up on that, Doctor, what concern is there in regards to maybe a second wave of cases if we start easing some of these restrictions? Everyone's been in their home, they now go out, and all of a sudden we have another surge or another spike of coronavirus cases. Is there a concern there, and how do we manage that moving forward?
Right, so there is a concern there because the modeling that the Bay Area is using basically has just one peak, one surge, and it doesn't account for a second surge. I would say that I and my public health colleagues are concerned that there could be either a second surge or an ongoing level of activity for some time after the first peak. And so based on that, there is a chance that we're going to have to continue to provide some type of social distancing, in particular, until we get a treatment for COVID-19, and until we can, until there's an effective vaccine, we can start immunizing folks to prevent further illnesses from this new virus.
Thank you, Dr. Moreno. Are there any other questions? Okay, if not, again, please look on the website for a copy of the shelter-in-place order, and we'll do a follow-up email with that link for those who need it. Thank you for joining us today.
Yeah, Mayor, I
Yes.
do have a question.
Great.
This is Jim Johnson with the Herald.
Go ahead.
This is a question for whoever wants to answer it. I'm wondering, has the county considered the economic, social, even health impact of the shelter-in-place order in comparison, say, to the potential impact of the COVID-19 pandemic outbreak?
I can start, and then maybe Charles might want to answer in terms of the economic side. But from the health and public health point of view, the sheltering in place order, which is intended to increase social distancing, is the most effective way of saving lives amidst this COVID-19 pandemic. There is no treatment, there is no vaccine, and without social distancing, we'll have a lot more people die. So from a public health perspective, that's really what we're focusing on. From the other health perspectives, we have thought about the impact of social distancing and sheltering in place on the behavioral health of our community. And for that reason, we have been working through MAYA and other outlets like 211 and our own call center and healthcare providers to remind people that there are options to contact someone through helplines, hotlines, for assistance and guidance for people who are feeling stressed, who are feeling isolated, alone, depressed. So we do have some of those trying to outreach and let people know that there are options for them. We're also working with social services as well. The concern that we and our social services colleagues have is that as people spend more of the time at home, and stress and concern from due to finances and due to other reasons, can put people who are already at risk of being abusive, a more likelihood of engaging in abusive behavior. And so that is a concern on behalf of our social services, and they are trying, as I understand, they are trying to do their outreach to let people know that if they are feeling stressed, they can call if they are, and remind people that if they are feel they're being victims of abuse, that they can also call the hotlines for social services and seek some assistance. As far as the economic impact, Charles, do you have any thoughts on that?
Thank you, Dr. Moreno. A few thoughts. First, I'm sure there's some smart people out there that could do the economic comparison between the shutdown type of approach that we're taking with the leaving open essential businesses and workers versus a more lenient approach, and what the exacerbation of the spread to the general population, how that might impact the economy at that point, because obviously there's going to be an impact if we shut down the economy, and there's going to be an impact if we stay fully open and allow the spread to exacerbate through the economy. And the difficulty of doing that cost-benefit analysis is something is going to be beyond my abilities, but I'm sure somebody will be coming up with it. I know there's some pundits out there who have said that the seniors among the population should just go out and work and risk their lives. And my response to that is that the pundits aren't putting anything into the economy really as a product that is beneficial to the GDP. So I think that's kind of easy to say. The economic loss to the county is something that we are starting to look at and starting to evaluate to both to the businesses individually, to individuals, the workers, as well as to the tax base of the county. And we are trying to calculate that, but it's obviously a moving target, and we're going to need a lot more data to be able to address it. One of the variables that is difficult to calculate in right now is the variable of the stimulus packages that are going through Congress and at the state level, both with unemployment insurance, which I know is not doesn't usually match wages, as well as some of the small business loans, the state pushing off the time within which small businesses have to pay their sales taxes, and essentially they get a loan of those sales taxes for a year. So they'll go from July 2020 to July 2021 to pay those sales taxes. So those kinds of pieces of help, I think, will be significant to moderating the economic impact to our economy. The ultimate price tag for this is obviously down the road, but I do hope that everybody takes advantage of the stimulus packages that are coming. I understand there's going to be another stimulus package coming soon out of the federal government, and the hope is that it'll put some more money directly into the workers' pocket so that they can spend it on essential services and be able to spend once the economy reopens. So that's kind of the short of it, and I guess the message is take advantage of all the economic pieces that are out there. Whether you're a worker who's lost their job, a business that is either closing down or cutting back their small business administration loans, or both. And there's also opportunities for those who are sole proprietors, who may not have even paid into the unemployment system. They can also qualify for unemployment insurance at this point. So with that said, it's a moving target and we are looking at it constantly.
Thank you, Charles. And here's one last question. Having not read the updated order in full yet, are there any changes for the agriculture industry?
So I don't know if our agriculture commissioner's on, if Dr. Moreno can chime in at all, but you know, it is an essential business. I'll let Dr. Moreno talk about that. And there have been agricultural guidelines put out for the appropriate way to have social distancing. And there have been several supervisors, Supervisor Aleo and Supervisor Lopez, who have been working with the ag industry to try and push some of those protocols. And we're being touted as a model for the state. However, I know that there are still some challenges of getting the message out about the appropriate social distancing that should happen with agriculture and agricultural workers. The challenge is obviously the buses that drive the workers to the fields, the harvesting equipment where they're close together working, and then when their living conditions can be pretty tight quarters. Dr. Moreno, anything to add?
Yeah, thank you, Charles. Yeah, I would just add that there's really I don't think there's any significant difference between what was in the previous order for ag and what's in this new order. But I do want to point out that in the ag section, it does say such businesses must comply with social distancing requirements and otherwise provide for the health and safety of their employees. So the ag is subject to social distancing like other essential services. And what Charles was referring to were specific guidance for the ag industry with suggestions on how they can achieve the social distancing in an ag setting. So thank you.
Thank you, Dr. Marino. And are there any last questions for any of our county participants? If not, thank you. And I hope this briefing has been useful and helpful. And thanks for joining us.